I want to hear about the child care, especially with the cuts that are happening in healthcare. We've been talking throughout the show about what is in store for people in terms of their health.
Well, I watched the early segment on the rates that are all already going up, because that's right. Insurance companies have to get those identified early before you enroll. This is a disaster, and I hope that everyone who's watching tells their members of Congress, the Senate, to add the protection for those Affordable Care Act premiums. In New Mexico, we know that our premiums are going to go up by 36%. But unlike other states, we've created all these funds. We'll be able to blunt a ton of that, but it means still that our already weakened healthcare system in a rural, poor state gets even harder for people to access, manage, and navigate. Clinics close, hospitals close. It really is a disaster, and they have a responsibility to protect Americans in this moment. He ran on that. He said he was going to lower costs. He was going to protect Americans. He's doing exactly the opposite, and we should hold this president accountable.
We often, Governor, talk about politics on this show at a national level. That's why we love having governors come on, because you can say on the ground what impact specifically this will have. We know that Medicaid is going to be cut. We know that some hospitals will have to close. What does that look like in New Mexico?
It looks like a special session next week where we're going to move funds into a Medicaid fund, again, to blunt those problems and to make sure that we're building access. I have a long way to go. I'd love to tell you that health care is solidly fixed with or without the federal government. Not true. I need those Medicaid funds. We have the highest per capita enrollment in Medicaid in the country. We're still a poor state with a lot of reserves and opportunities, which is why we're doing universal child care. We want to build wealth for families and improve well-being and outcomes. Well, we don't do that without a federal partner in the health care environment. And this nearly $1 trillion cut, which is a giveaway to billionaires, is an outrage. And what it does is it stops funding children, disabled adults, folks with chronic disease. And you'll have policymakers tell you that's not true. It is true, because all that money is bundled together. It sets the costs. It's how hospitals stay afloat. And then only the sickest people are covered, which means healthcare costs go up, because we average what those payments or premiums are based on a mix of populations. This is a disaster.
Governor, can you explain how, even though a lot of these cuts are going to come after the midterm elections, cynically positioned that way, that right now rural health care, which has been in a crisis for a decade, hospitals now, nursing homes now, neonatal units now are having to adjust and slash employees, cut back services for working Americans.
Right now, you just said it. I don't need to say it again. Thank you, Joe. That's happening right now. And a lot of the effects happen in October, and enrollments happen right now. Medicare changes are happening right now. Prevention is gone. Prescription drug costs are going up. Just look at the vaccine debate in the country right now. I just got a call from a legislator who called me about a constituent. I think her name is Nicole, a veteran. And the Veterans Hospital won't provide any of the flu or COVID vaccines, and it was going to be hundreds of dollars. Our state covers that. But a lot of states aren't going to do it. They won't, or they can't. And working Americans can't support their families, which is why let's talk about universal child care, blueprint for America.
There you go. Rev?
No, universal child care is right. Let me ask you this, Governor. For many people of lower income, child care is even more of a problem and more of a burden. For governors that have not been out in front of this as you have to and prepared for this, how do advocate groups go to their governors now and say, what do you do now with this big, beautiful bill, big, ugly bill? How do we start moving different states to duplicate what you've done in New Mexico?
Well, I've got good news. Reverend,
like
11
good
states.
news.
Do you like good news? 11 states, including some of my Republican colleagues like Montana. And good news for Governor Beshear. He's making changes to his child care system with the Republican legislature. You can create a department, move all of the things that are already supported or funded by federal government, like family and infant toddler. You already get some daycare funds. Put all of that together, home visiting, and then start to get small amounts of money, put it in, get a revenue stream going, put it into a trust fund. That's what we did. We took $300 million. It's now at $9 billion. I used the largest sector, which is oil and gas in our state. I put money into that fund. We also have $65 billion. Now, other states don't have that in a permanent fund. But I asked voters, what's important to you? Well, this is important to them. Overwhelmingly, they voted to include pre-K and child care as a constitutionally protected benefit in these permanent funds. And so then you start building it. I expanded to 200% of poverty. Then we did 400% of poverty, no copays, easy to navigate. And now we just said, we're just lifting it because then we're investing in quality and we are saving money as a result. And lastly, it has a huge boost on the economy because you know who goes back to work? Women. And you know women who have to take a year or 2 years off, they make 40% less than other women in taking that year off. That means less retirement, less Social Security, less overall earnings. So I'm building entrepreneurs because we're making new child care centers. We can do that in rural areas. Now you've got rural economic development. You're investing in quality. I also pay child care workers as the professionals they are. Licensing, certifying, $18 to $21 at the very least.
All right, Democratic Governor Michelle Lujan Grisham of New Mexico, thank you very much for all of
you.
this.
Thanks,
And thanks
Governor.
for coming on this
Governor.
morning.
You're welcome. You guys
Putting up
need
with
some
Joe.
good news.
Yeah,
need some good
you know
news.
what? We do.